So relaxed. And I got the munchies, man. Hey, what's this? I'm so paranoid and I can't stop puking.
Cannabis sure has changed over the years, and so has its side effect profile. How can we treat the intense vomiting of cannabinoid hyperemesis syndrome, aka CHS, or the Anti-Munchies? How can we convince patients to believe this condition even exists? How can we help them? Our brains use chemical receptors to regulate our perception between the extremes of nausea and hunger. Endogenous substances regulate this balance in both directions. Low levels of cannabinoids can stimulate these receptors and shift the balance towards hunger and the munchies. However, frequent high levels of cannabinoid exposure overstimulates these receptors. They become downregulated and don't work as well. Now the problem is that endogenous compounds don't affect these receptors normally either. The balance is disrupted, and now we experience so much nausea that we can't stop vomiting. Fun facts about the Anti-Munchies include that it's associated with newer high-potency cannabis strains, but it doesn't affect all users. It's resistant to some of our best anti-nausea drugs, and weirdest of all, many patients with CHS say that hot baths or showers help the nausea, as well as things like capsaicin that cause the sensation of heat. It's thought that heat perception releases neuropeptides that partially correct the imbalance in the brain's emesis centers. Treatment should start with an EKG to make sure electrolyte disturbances from protracted vomiting haven't dangerously prolonged the patient's QT interval. Our old pal on Dancitron rarely does the trick, so I don't even start there. Dopamine-blocking agents such as antipsychotics work way better, which is interesting when you remember that cannabinoids can also trigger psychosis. My favorites are haloperidol, droperidol, or olanzapine. Because it's really rare for any one agent to work alone, I always put on capsaicin cream at the same time. I don't wait. If your hospital doesn't have it, just go to your local drugstore and buy it and bring it to work so you're ready. Apply it to the patient's abdomen and tell them not to touch it so they don't accidentally pepper spray themselves by touching their face or worse, their genitals. If it's too painful, put an ice pack on top. You'll still get the benefit of the capsaicin. At the same time, open a few isopropyl alcohol pads, put them in a specimen cup, and have the patient inhale from it periodically. This also reduces nausea through some unclear mechanism. Remember, your best chance is to use several agents simultaneously instead of one after the other. As soon as the patient can tolerate something PO, I usually give oral promethazine and rarely a single low dose of clonidine as long as the patient's blood pressure and heart rate can handle it. But that's sort of a last-ditch thing. For discharged patients, consider prescribing a small number of haloperidol tablets, which the patient can let melt sublingually, and I often add a prescription for topical capsaicin and compazine or promethazine suppositories, because you can't throw those up. Long-term treatment is a lot tougher because the best treatment for cannabinoid hyperemesis syndrome is stopping cannabis use. Most patients do not want to hear this, and they will work hard to not believe you.
Why would something natural be bad for you, man? Weed is from Gaia. It's a gift. And Gaia doesn't make poisons. That's not true. Cobra venom is 100% natural, but that's not good for you. Yeah, okay, but I've been smoking.
They rely on marijuana for important social, cultural, medical, and recreational reasons. They may dismiss and evade every explanation you give.
Yeah, my sister's a CNA, and she's been smoking weed, and she says she's never heard of this. Well, not everyone is equally affected.
Don't try to win the argument because you'll lose every time.
Well, my grandma's very wise, and she said weed is good for your appetite. Are you saying she's a liar?
Instead, challenge them a little. Suggest they try abstaining for 2 weeks. If they can't do it, it might get them thinking.
You're just afraid weed will put you out of business, man. That's your hang-up. Oh, that's not true, man. I love weed.
Suggest that they check out their local dispensary for a lower potency THC product. This may not solve the problem, but it shows that you're not a judgy anti-weed buzzkill. Many CHS patients have had extensive GI workups that were negative, so ask them to consider that as well. Your goal here is not to win an argument, it's to help the patient and plant seeds of certain concepts that may eventually blossom into acceptance down the road. It's actually a lot like growing, well, You know, man,